A root canal treatment is a dental procedure used to remove infected or damaged tissue inside a tooth. It is typically used to save a tooth that would otherwise need to be extracted. During the procedure, the dentist will make an opening in the top of the tooth, remove the damaged tissue, clean the inside of the tooth, and then fill and seal it. The tooth is then typically restored with a crown or filling. Root canal treatment is typically done to relieve pain or tooth abscess and to prevent future infection. Overall, root canal treatment is a very common and relatively routine procedure that can help save a damaged tooth and alleviate pain. The steps of a root canal treatment typically involve the following. Diagnosis and preparation. The dentist will take X-rays of the affected tooth to determine the extent of the damage or infection. They will then numb the area around the tooth to make the procedure more comfortable for the patient. Access. A small opening is made in the top of the tooth to access the inside. A rubber dam will be placed to isolate the tooth being treated to prevent saliva and bacteria from entering the treated area. Removal of the damaged pulp. The dentist will use special tools to remove the infected or damaged pulp from inside the tooth, as well as any other debris that is present. This is done using an endodontic files and a handpiece. Cleaning and shaping. Once the pulp and debris have been removed, the dentist will use special instruments to clean and shape the inside of the tooth to prepare it for filling. This step is crucial to prevent reinfection. Disinfection. The inside of the tooth is disinfected to remove any remaining bacteria or debris. This may involve irrigation with antimicrobial solution. Filling. Once the tooth is clean and disinfected, it is filled with a special material called gutta percha. This material seals the inside of the tooth and protects it from further infection. Restoration. The tooth is then restored with a filling or crown to protect it and restore its function. Post-operative care. After the procedure, the dentist will give instructions on how to care for the tooth during the healing process, and schedule a follow-up appointment to evaluate the healing progress. Keep in mind that the actual steps and instruments may vary depending on the individual case and the dentist's preferences and experience.